We live in a world where the number of pediatricians is very limited. The few that we have are concentrated in urban centers, placing 95% of all newborn care in the hands of midwives and nurses that are less specialized to manage and make clinical decisions for the sick newborns. And so we developed PRISMS to empower the 95% of the midwives that actually manage the newborn cases to effectively manage them. My name is Martin Mukama. What we came up with is called Protecting Infants Remotely by SMS. It's a simple tool. All a midwife has to do is to fully assess the sick baby, input the assessment findings in the PRISMS phone, and the PRISMS will give the midwife a management plan in only 8 seconds. And that plan is similar to what a pediatrician would have offered. Previously, we have been heavily involved in training midwives and nurses in helping babies survive. But what we discovered is that the skills decayed so fast, and newborn care was not really standardized even among the midwives that we had trained. And so that really inspired us, because we already knew that the abilities in assessing the children was very good, but they lacked abilities to make clinical decisions. During our randomized control trial, we deployed in a facility called Rukunyu. And prior to deployment, they had this sick newborn at the neonatal intensive care unit that really was not changing state for about 4 days. And then we come in with PRISMS, we train the midwives on how to use the technology, on how to assess the babies and input the assessment findings in PRISMS, and then it provides management plans. And so we deploy the technology, they start using the technology, and then we go back to conduct a quality improvement meeting. The baby that had been at the neonatal intensive care unit for 4 days without improving, after using PRISMS, within 3 days, the baby started improving significantly. It healed and was discharged. The challenges that we noticed with the first deployment were the way we had structured the architecture was very difficult, because the messages were not coming as a single string, and that way the midwives had challenges interpreting the information that we were sending back to them. And so we went back to the round table and said, you know what, we need to build algorithms that run independent of each phone. So if we have the algorithm running, let it be running on the device that the midwife has. And that has seen the technology scale the way we want. We've been sort of scaling this innovation through the different partnerships that we've built. We have partnerships with Sim for Life at Mbarara University. We have a partnership with Doctors with Africa, Kuam, Clinton Health Access Initiative. And through the support, the different support through the Ministry of ICT, we partnered with the Ugandan Embassy in Burundi, and we developed the French version, and now the French version will be taken to Burundi. But also the purpose of creating the French version is not just Burundi, but to spread the technology to Francophone-speaking countries. So this is our big picture. The first thing that we want to do is to detect a change in neonatal mortality at national level in our country. In the facilities where we are working, we have discovered that neonatal mortality has dropped below 8%, but that has not been detected at national level. And the reason for that is because we are just working in 66 facilities out of about 18,000 facilities. So what we would like to do is to have our solution scaled to other countries, and we also plan to have franchise models so that we can reduce neonatal mortality in Africa, because in the Western world it just stands at 3.5 deaths per 1,000 live births, which is very low. It really means so much for Uganda to be participating in the Innovation Week at the Dubai Expo. That will ignite the discussion for partnerships, which is very critical for the different people that will be there from Uganda, so that we can have our solution scaled up and different challenges being solved. that Uganda is a country that has potential to solve different socioeconomic challenges that are even global, because innovations like PRISMS have the potential to scale. Call upon all young people to at least identify a challenge that you can solve. You have the ability to build your own business, and you have the ability to create jobs for the different young people in our country.